teachers and military officers across the country will now begin to receive the COVID-19 jab after the official launch for both priority groups. Teachers aged 50 will be the first cohort to receive the vaccine in a campaign that targets nearly 500,000 teachers from both public and private institutions. And as Dorcas Wangira reports, the government continues to assure Kenyans that the Oxford-Astrazeneca vaccine is safe, having passed through sufficient clinical trials.
The Teachers Service Commission, TSC's CEO Nancy Macharia, was today the first teacher to receive the COVID-19 jab. Other teachers and union representatives from KUPPET, NAT, KEPSHA and the Kenya Union of Special Needs Education Teachers, KUSNET, followed suit. Kenya has since the onset of the pandemic lost 41 teachers and 3 secretariat staff to COVID-19. And for Kenya's 500,000 teachers both in public and private institutions, the vaccine, the government says, is crucial to prevent progression to severe disease, hospitalization and death that has come with a steep cost, particularly to teachers aged above 50.
Our data shows that teachers who are 50 years and above may be having pre-existing conditions, so we are already covering them. Now, those who are below 50 and have pre-existing conditions are going to be considered immediately the vaccines start becoming available. We are beginning with the teaching staff. And very soon, again, once we get the second consignment, which may be beyond 1 million, to cover the second dose, we are going to onboard other staff.
We have these teachers who are actually invigilators and supervisors and examiners, and we are saying actually they should be prioritized, because even as some of the 50-year-olds go home, some of these teachers will be left with the students and so on.
Teachers will be required to use the Chanjo Kenya platform to pre-register and select the post and the date they are required to be vaccinated. Another cohort considered frontline is the military, and the Chief of the Defence Forces, General Robert Kariuki Kiboshi, also received the jab at the Kahawa branch, setting the stage for other military officers. Kenya has prioritized the officers by rank and location.
I've taken that vaccine. There is no effect. Even the kind of pain that you would expect when you get vaccinated is not there. We have teams that are vaccinating in the Navy, in Tongwe. We have teams that are in Nanyuki, vaccinating Laikipia, Nanyuki Garrison. We have teams in Gilgil, doing the Nakuru region. So we are doing it concurrently. And yes, we will also be doing it for the troops that are inside Somalia.
Makueni Governor Professor Kivutha Kibwana was also vaccinated against COVID-19 at the Makueni County Referral Hospital, as he urged Kenyans to disregard misinformation and propaganda being spread against the vaccine.
Haina madhara, ni chanjo ina manufaa sana kwa watu wetu wa Kenya kwa ujumla.
Meanwhile, Denmark has temporarily suspended the AstraZeneca coronavirus vaccine as a precautionary measure due to cases of blood clots in people who received it, though the connection has not yet been established and investigations into the actual cause of the reactions in patients is still ongoing. The government maintains that the AstraZeneca vaccine is safe, having gone through 3 clinical trials, been approved by the WHO and the Pharmacy and Poisons Board.
Such side effects were evaluated. You do not do a clinical trial, especially phase 3 in humans, without looking at those. With the vaccine, one of the things we see, there's also a lot of competition among manufacturers to discredit others. So until you really read and understand things behind this, it's not appropriate to make conclusions.
Teachers have officially joined the queue, just like other frontline workers receiving the COVID-19 jab, in a month which is critical for Kenya's academic calendar, where both the KCPE and the KCSE exam will be written at the time of the pandemic. Dorcas Wangira, Citizen TV, TSC Headquarters, Nairobi.